Eaton Community Health Center site manager. I'm a registered nurse, and I am also a resident of Berry County. I went to high school here, actually went all throughout school here, moved away when I graduated from high school, and returned not that long ago. The ability to serve the community that I live in and grew up in makes my role much more meaningful. I've had the opportunity to, over the last year or so, to speak to many of you or your organizations about the Berry Community Health Center. My goal today is to inform those of you who have not met of the services we offer, highlight 2 programs that align closely with the most recent Community Health Needs Assessment on mental health, and ask my colleague Alicia here to spotlight our dental program. But first, I'd like to quickly tell you more about Cherry Health. The services we originally started with here back in 2014 may or may not fully meet what's needed now or in the near future. Like Penic is a part of a larger healthcare organization, offering many more specialties, programs, and resources through Spectrum. The Berry Community Health Center is part of Cherry Health, offering the same support. If you identify any gaps in care you feel Cherry Health may be able to help with locally, please feel free to reach out. So quickly, I promise. Cherry Health was established in 1988 and is the largest federally qualified health center in the state of Michigan, with over 20 locations serving 7 counties with over 12 different major services. Our primary focus is to provide high-quality health services to those who have little or no access to health care, regardless of income or insurance status. Here's a map of our locations in Kent, Montcalm, Berry, Eaton, Muskegon, Ottawa, and Wayne counties. Okay, so our mission is to improve the health and wellness of individuals by providing comprehensive primary behavioral health care while encouraging access by those who are underserved. Our vision, that our communities will be healthier because we will seek out and welcome those who need our services. All will be treated as family with integrated, coordinated care to improve health and personal well-being. And I really love the mission and vision. It's my favorite of any healthcare organization I've ever worked for. Cherry Health takes it very seriously, as does my entire team at the Berry Community Health Center. Cherry Health's overall services include primary care, that's family practice and internal medicine, pediatrics, women's health, OBGYN, school-based health centers, school-linked programs, vision, dental, pharmacy, mental health including psychiatry, behavioral health with integrated programs, medication-assisted treatment centers for substance use disorders, and correctional health. Here are some 2017 organizational stats on patients served. We just missed out on the 2018 data. And then here's a graphic of 2018 revenue sources by payer, if interested. Some people are. Oh, sorry, I'm one behind. One additional role Cherry Health takes very seriously is advocacy to ensure underserved patients and communities have a voice in state and national level policy making regarding their health care. Advocacy also allows for innovation, which some of these programs certainly represent. You may not be able to see the wording there, but I can tell you this slide is taken from the Cherry Health website. The entire graphic is a timeline of the last 30 years. I included a few programs that I feel are especially interesting. CTC is a prison reentry program in both Kent and Wayne counties. CAP rebuilds patient ties to families, communities, jobs, places of worship. Burton is a health center within a school for all students and families of students. And Southside is one of 2 medication-assisted treatment centers for those with substance use disorders. There are many more unique programs, these are just a few that demonstrate the scope of what Cherry Health offers in Michigan. Again, if you feel there's unmet need within Berry County that Cherry Health may be able to close the gap on, please feel free to reach out. So, back to the Berry Community Health Center. Thanks to these very generous donors, here we are, located 2 blocks away to my left, your right, in the lower level of the Ace Hardware building. A very accessible site that allows all of our services to be within the same space. We're currently open Monday through Friday with 1 late evening for after-hours access, and that's Monday. We have same-day appointments and emergency walk-in dental care that Alicia will talk about more. We continue to accept new patients of all ages, regardless of insurance status or income. We accept Medicaid, Healthy Michigan, commercial insurance, Medicare, self-pay, and we offer sliding fee to all who qualify. Patients do not need to be Berry County residents to receive care at the Berry Community Health Center. Since we're talking about payer, here is a breakdown of payer type, if you're interested in seeing that. I'm proud to say we are designated by NCQA, that's the National Committee for Quality Assurance, as a level 3, the highest level patient-centered medical home. It's a patient-centered approach to care, a commitment to continuous quality improvement, reducing healthcare costs, improving the patient experience, and increasing staff satisfaction. So here are our providers for family practice: Dr. Stasia Lagarde, Dr. Java Neely. For dental, Dr. Tyler Veneman and Dr. Christopher White. We also have a dental hygienist, Corinza Heflin, who's not pictured. Our primary care family practice services are for all ages and include, as you can see here, preventative care, wellness visits, chronic disease management, minor acute illness injury, well-child exams, sports physicals, immunizations, some substance use treatment options. We currently have a Vivitrol program, and we'll soon have Suboxone as well. Care coordination, and finally, because we are certainly looking at the whole person, nutritional support and outpatient therapy or counseling. So in 2018, we had 5,322 visits with just over 1,200 patients in total and climbing. So providing these services is pretty straightforward for most of our patients, but definitely not for all. Our patient population also includes those who face real obstacles to overall health and well-being, which many of you here are already certainly familiar with. Those with literacy or language barriers, complex, sometimes ineffective personal support systems, physical disability, financial, housing, employment, or food insecurity, education level, lack of dependable transportation, struggles with mental health and substance use or opioid dependency, history of physical or emotional trauma, those who've been fired from other doctors' offices for unacceptable communication or other behaviors, non-adherence to treatment plans, legal issues, even intermittent incarceration, or those without resources most of us take for granted, like an address or even access to a phone. That said, I have a team of very compassionate, mission-driven staff who use every resource available, internally and within this community, to overcome these. The key to success is to also meet patients where they're at with compassion and patience, as I know many of you know. It's definitely what we're here for, what our model is designed for, and what offers my team the greatest reward. I know you can't read that. But I did promise to highlight 2 exciting programs we offer that somewhat align with the Community Health Needs Assessment. This is a 5-year Spirit research study from the University of Washington in Seattle, also involving the University of Michigan. It's the study to promote innovation in rural integrated telepsychiatry for PTSD and bipolar. If anyone has taken a tour of our new site in the Ace building, I've shown you the exam room that looks more like a living room, a couch and a large screen TV, where patients meet remotely with the University of Michigan psychiatrist or psychologist. This study goes through 2020 and has been very successful for enrolled patients. And from the U.S. Department of Health and Human Services, SAMHSA, that's the Substance Abuse and Mental Health Services Administration, a 5-year grant for promoting integration of primary and behavioral health care. That involves Cherry Health, the Berry Community Health Center, and the Berry County Community Mental Health Authority, which we've just started. This just began. But both examples bring innovation to Berry County, addressing real needs of this community in new ways. And I certainly look forward to additional opportunities in the future, which Cherry Health supports and initiates. So, thank you for your time and attention on this piece. If you have any questions, I've left contact information and resources in the back. I'd now like to introduce Alicia Walker, Cherry Health Dental Supervisor, who will spotlight our Berry Community Health Center dental services. Very important to our community. Thanks.
Hello, good morning, guys. So dental is kind of cut and dry, but there are some things we want to highlight with our Berry Community Health Center. So the dental services that we offer are exams, X-rays, cleanings, fillings, crowns, root canals that sometimes are needed with the crowns or before, dentures, periodontal treatment. Periodontal treatment, kind of deep cleaning for the gums patients that have gum disease to maintain their teeth. We offer emergency walk-in dental services. That's super important and something we want to highlight with Barry. Our walk-in services are not just for patients. You don't have to be a patient in the health center to come in. You come in, our doors open 7:30 in the morning, you walk in, they accept a certain amount, but we love to help people that are in pain, something's wrong, and they don't have to feel like they're not a patient so they can't be seen. We see them, we treat them. If they need medication, antibiotics, if they need an extraction, they need services referred out. We serve those people, those underserved that have nowhere to go and they're in severe pain. We want them to know that we're here in the community for them and they can come in, they don't have to be a patient with us. In 2018, Barry Dental saw 3,572 patients and 447 were walk-ins within our community. And that's about it. Cut and dry.
And there we are again. Any questions? Was that help? Liz, go ahead.
You said that someone's getting licensed for Suboxone.
Yes.
When will that come online?
I anticipate probably within the next 3 months. So the provider, Dr. Stasia Lagarde, still need to take her training. We'll get the program in place and move forward. And I hope that will be a great opportunity for this community for sure. What other questions? Go ahead.
Are there any plans in the works for 7-day service?
Say that again. For what service?
Are there any plans in the works for 7-day service?
I would love to be able to offer services on the weekend. I would also love to be able to offer walk-in for more than just dental. That's certainly under consideration. A start time has not been determined, though, no. Do you feel there's a need in the community? That's my question. I'm going to assume so since you asked, but
I would think so. I don't have any statistics, but I would think that there would be.
yeah, I would agree. Thank you for asking, and I will definitely ensure my administrative team is aware that that is a request.
Thanks for your answer.
Sure. Was this helpful information? Okay, great. That was our goal today. We partner with many of your organizations. We'd love to partner more. Lanny and I, a couple weeks ago, were spending time together at the Beer Community Health Center, helping us a patient who was literally dropped off at our doorstep earlier in the day. It took a lot of time and effort, but it was worth it for that patient for sure, and that's what we're here for. Thank you.
Thank you again so much for coming. Again, if you could fill out the surveys, that gives us insight into some resources that we need to find and gather for further presentations. I believe that there is still a little bit of food left if you guys are still hungry, if you need to grab a snack on your way out. Again, thanks for coming.